So next topic is pterygopalatine fossa. Pterygopalatine fossa, as a matter of fact, it's ventromedial continuation of infratemporal fossa. So if you find infratemporal fossa and you go a little bit ventrally and more medially, you reach to this fossa, which is called pterygopalatine fossa. This fossa looks like an inverted pyramid. So the apex is down and the base is up. So the base is going up there to the roof of the pterygopalatine, and the apex, as you see, is becoming narrow through the which canal is here? What is this canal? Greater Palatine Canal. It has another name thanks to this fossa, pterygopalatine canal, that it passed descending palatine artery, which is then divided to the greater palatine artery and lesser palatine artery, and also greater palatine nerve. So down caudally, it's communicating to the hard palate and soft palate, which is a roof of the oral cavity, as a matter of fact. So to recognize the position of this pterygopalatine fossa and connection it with the infratemporal fossa through the fissure, which is called pterygomaxillary fissure, this connection. So this pterygopalatine fossa also is communicating with the neighborhood structure. It can communicate it to the middle cranial fossa. Remember, in infratemporal surface of the greater wing of the sphenoid bone, it opened foramen ovale and foramen spinosum. But in maxillary surface of the greater wing of the sphenoid bone, which is here, it's open another foramen, which is rotundum. Then immediately, logic, you can say the content of the pterygopalatine fossa is maxillary nerve, second branch of trigeminal nerve. Yes? Pterygoid canal also, it's open to the pterygopalatine fossa that we are going. So they are connecting, and since foramen rotundum or round foramen is inside the middle cranial fossa, through that it can communicate it to the middle cranial fossa. Or through the pterygoid canal, it can communicate it to the fossa. Through the pterygomaxillary fissure is communicating with the infratemporal fossa. Through the inferior orbital fissure is connected with the orbit. Through the lateral wall of the nasal cavity. So here is this bluish one is which part of palatine bone? Perpendicular plate of the palatine bone, thank you. And the place of attachment of perpendicular plate with the sphenoid bone, there is a foramen which is called sphenopalatine foramen. And through this sphenopalatine foramen, it passes. If you had a wire and you put inside the sphenopalatine foramen, you go to the nasal cavity. So it's past the sphenopalatine artery and posterior superior nasal branches. So it's connecting with the nasal cavity. So finally, the connecting with the lower part, which is the roof of the oral cavity, which is making the hard and soft palate. So in this case, you have the borders of the pterygopalatine fossa, which is anterior border is the tuber maxilla or maxillary tuberosity, which is also making a border of the infratemporal fossa. Posteriorly is anterior margin of the pterygoid process of the sphenoid bone. And the medial wall is this perpendicular plate of the palatine bone, which is separating the nasal cavity from the pterygopalatine fossa, except this foramen that we needed. And lateral wall, there is no wall. Lateral wall is open to the infratemporal fossa through the pterygomaxillary fissure. Yes? So continue medially from infratemporal fossa, you go to the pterygopalatine fossa. Continue laterally from pterygopalatine fossa, you go to the infratemporal fossa through pterygomaxillary fissure. And as we said, that the roof is making by the greater wing of the sphenoid bone, specifically the maxillary surface, which the foramen rotundum is open. The content, now you can understand. So here is maxillary nerve and the branches that we are going to discuss. There is a pterygopalatine ganglion, is another parasympathetic ganglion, which is responsible for innervation of the lacrimal gland. Also is innervation of the minor salivary gland and mucus secretion of the glands that they are location above the oral fissure. So in hard palate, soft palate, nasal cavity, those are all responsible for the secretion, this pterygopalatine ganglion, which is the periganglionic, is coming from the greater petrosal nerve, and the postganglionic via the branches of the maxillary nerve that is called ganglionar branch, or the pterygopalatine nerves that we are going to discuss. So communication, it's very important of the pterygopalatine fossa. The communication medially, it means that it's going through the sphenopalatine foramen to the nasal cavity. Yes, so communication goes medially to the nasal cavity via the sphenopalatine foramen, and through this foramen, as we said, it passes sphenopalatine artery and the lateral and medial superior posterior nasal branches for the nasal nerve innervation. Inferiorly or caudally, if you go down, you will reach to oral cavity via hard palate and soft palate, via greater palatine canal or pterygopalatine canal. What does it pass? Descending palatine artery, greater palatine nerve. Superiorly and posterolaterally. Superior, posterolaterally. It's the foramen rotundum, connecting to the middle cranial fossa. What does it pass? Maxillary nerve. A little bit down and medially, there is pterygoid canal. What does it pass? Nerves of the pterygoid canal. What are they? Greater petrosal nerve and deep petrosal nerve, very important, and artery and vein of the pterygoid canal. You're going a little bit down, inferiorly and posteriorly and medially, you have another canal which is called palatovaginal canal. It's connected with the nasopharynx. Where does it pass? What does it pass? Pharyngeal branch of the maxillary nerve and pharyngeal artery. Here is the sphenoid bone. To remember, this is the greater wing, and here is the foramen rotundum that is in the maxillary surface. It's open, and here it passes the maxillary nerve. And here is the place that the pterygoid process is attaching to the body. So it's the pterygoid canal, and through the pterygoid canal it passes the greater petrosal nerve, deep petrosal nerve, and arteries of the pterygoid canal, or Vidian canal is another name. We said that the communication laterally it's connected with the infratemporal fossa through the pterygomaxillary fissure, and through this pterygomaxillary fissure from infratemporal fossa, it's continue maxillary artery, the third part, and also some extension of the pterygoid venous plexus. The pterygoid venous plexus, that is a main component of the infratemporal fossa. It can go medially to this pterygopalatine fossa. And here, finally, it's the connection of the pterygopalatine fossa ventrocranially through the fissure, which is called inferior orbital fissure, and it's connected to the orbit. And what does it pass? Zygomatic nerve, infraorbital family, artery nerve vein, and also the inferior ophthalmic vein. Some small smooth muscle also is there, which is called orbitalis muscle. Yes? So those are the communication of this small fossa, but it's the cross line to communicating with the different area, neighborhood area. And do you know what is it? This is Alcatraz. For me, in anatomy, pterygopalatine fossa is Alcatraz. The student that they don't know anatomy, I will take them to the pterygopalatine fossa, which is Alcatraz. Usually they cry for hours. It's dark, it's smell bad. There are rats there going there. And then they say that, okay, in the medial wall, there is an opening. I go to the nasal cavity through sphenopalatine foramen. So I can escape from this Alcatraz fossa pterygopalatina. But there is a soldier there, sphenopalatine artery, and posterior superior nasal nerve. They kick you and going back. Then you cry 2 hours more. Then you go, okay, I go downstairs. I go to oral cavity, to the hard palate, soft palate, through the pterygopalatine canal or greater palatine canal. But there are soldiers. What are there? Greater palatine nerve and descending palatine artery, pushing you back. Then you say, okay, it's not. Ventrocranially, I go to the orbit. Through inferior orbital fissure. They are very aggressive soldiers. What does it pass through the inferior orbital fissure? Zygomatic, infraorbital family, artery nerve vein, and inferior ophthalmic vein, orbitalis muscle, going back. Say, oh my God, what to do? Okay, posterior superior, foramen rotundum, maxillary nerve pushing you back. Okay, go down a little bit, go to the pterygoid canal, Vidian canal, greater deep petrosal nerve pushing you back together with the artery of the pterygoid canal. Go to the pharynx, nasopharynx, through the palatovaginal canal, so going back again to the pterygopalatine fossa. Oh my God, what to do? Then you will look at the lateral wall. There is no wall. It's the pterygomaxillary fissure, which is communicating with infratemporal fossa. There just past ending branch of maxillary artery and extension of pterygopalatine fossa. I'm not joking, so this is the student that I'm taking it to the Alcatraz pterygopalatine fossa. So here is the communication that be careful of that it's very important. As I mentioned, that is the third part of the maxillary artery, which is going to the pterygopalatine fossa. It's giving also the branches. So the branches of the third part of the maxillary artery, which is the infraorbital, now you know it, all of them. Oh my God. Infraorbital artery, where does it go? You are now expert to the opening of the skull. Tell me. Infraorbital artery where? Inferior orbital fissure. Thank you. Sphenopalatine artery to sphenopalatine foramen. Posterior superior alveolar artery where? Tuber maxilla. artery of the pterygoid canal to pterygoid canal, descending palatine artery to greater palatine canal or pterygopalatine canal. So all of them is the content of the pterygopalatine fossa, and you now will learn the third part, and the branches of the third part of the maxillary artery. And for your understanding, so here is the table with all the branches that I already mentioned for the maxillary artery. And also here, for example, you can see the posterior superior alveolar artery, which is supplying the upper teeth. This is the infraorbital. This is the that is giving the alveolar branches. And also, additionally, we said that the pterygopalatine ganglion also is located there. And the branches of maxillary nerve also is located there. So the most famous branch and the major branch of the maxillary artery is infraorbital nerve, that it's going to the inferior orbital fissure, and then it coming as an infraorbital foramen. Yes, and zygomatic nerve, which is going to the inferior orbital fissure from the pterygopalatine fossa, and then it goes to the zygomatico-orbital, and then it's coming as a zygomatico-fascial and zygomatico-temporal nerve. Yes, but maxillary nerve, it has additional branches that totally there are 7, and they are generally called pterygopalatine nerves or ganglionic nerves or branches. And those are the nerves that they carry the postganglionic parasympathetic fiber or secretomotor fiber and sensitive fiber for the glands and area that is secreting above the oral fissure. So it means hard palate, soft palate. You have in the nasal, and you have in the nose some secretion. So this is pterygopalatine ganglion, maxillary branches. You have in the hard palate, soft palate secretion. So there are moisture always. Yes, salivary gland, they are there. Mucous gland, they are there. So this is responsible for the secretomotor. This greater palatine nerve, lesser palatine nerve, the nasopalatine nerve, the posterior inferior, posterior superior nasal nerve, tonsillar branch for the palatine tonsil. Those are all the area of the territory of the maxillary nerve that is innervating for the sensitive and secretomotor, thanks to the pterygopalatine ganglion. And here is the recapitulation of those nerves of the branches of the maxillary nerve that you have it here. And here is the pterygopalatine ganglion, pterygopalatine fossa, and the maxillary branches that is innervating all this structure that I already said. As I said, the medial extension of the pterygoid venous plexus in infratemporal fossa can or could be extended to the pterygopalatine fossa because it's a plexus, so it's variable, and some veins it can reach to the pterygopalatine fossa together with the maxillary artery. These two structures, they are located in infratemporal fossa and also the pterygopalatine fossa, and they are communicating through the pterygomaxillary fissure. In X-ray, you can recognize the pterygopalatine fossa. Here is the nasal cavity. Here is the sphenoid sinus, which is better understanding. Here is this cross-section. If you know that the anterior border of the pterygopalatine fossa is maxillary tuberosity, so it's enough to find the maxillary sinus here, and the posterior wall of the maxillary sinus is maxillary tuberosity. Here is the anterior border of the pterygoid process, so here is the pterygopalatine fossa. Yes. So as you see, pterygopalatine fossa in here in this CT scan is absolutely normal, and you have to recognize what is normal to see what is abnormal. Suddenly you will take the CT and you see, wow, something here growing. And because it's deep, the patient doesn't see. If I have something in my lower lip or upper lip or tip of the nose, so I see every day in the mirror and say, okay, it doesn't heal, so I go to the doctor. But deep in the infratemporal pterygopalatine fossa, I don't see. Yes, so there are growing tumor, and then it caused some of the structure injury to this or trauma to one of these structure that we mentioned, and the symptom it appear, and then the patient will come to you. So, and suddenly you see a big tumor here, or here, for example, a big tumor that is penetrating to the nasal cavity, penetrating to the maxillary sinus. This is the patient that its foreign body is broken the jaw, and it went to the pterygopalatine fossa. So this is the clinical importance of these two important fossa that I wanted to tell you.